All right, Darnez, let's take a look at this. The difference between the two throws, I didn't even want to really analyze the other one because, like you said, you were 100 pounds heavier. Obviously, you were pre-surgery. Things, I don't know what you had surgery on, maybe the knee because I see a knee strap around the left knee there. But either way, this is a way better throw to analyze because the other one is not indicative of obviously how far you've come since then. So let's take a look at this. I like seeing videos from the side because it shows me speed and shows me the linear aspect of it. I really do prefer videos from either the front or the rear just because I'd like to see how far you get out around that left at the beginning of the throw. So let me explain what I mean here. Right now, coming out of the back, two things we want to see. One is this. One is seeing that knee get to 12 o'clock. Okay, that left knee getting to 12 o'clock. So you're doing that pretty well here. The one thing I think you can afford to do, just to give yourself a little more patience out of the back, and I'm going to go forward to here. Okay. So what you can see here is your body is already starting to lean into the center of the circle. That's fine, but I think you can afford to actually get out around the left more and then come to center of circle. All right? Hopefully that makes a little bit of sense. If you take a look at the Krauser breakdown that I did on my YouTube channel, you'll see that Krauser gets way out around that left side, and his entire head, shoulder, hip, knee, and foot are in alignment. What you want is you want your left armpit over top of your left knee. And right now what I can see is your left armpit is just slightly ahead, which means you've turned it into the center a little too soon. No big deal, but if you can be patient out around that left out of the back, much like Krauser does, I think that'll help you a little bit in terms of getting through the center of the circle with even more speed. Okay, so that's one thing. That's awesome though. Everything here is looking really good. So now let's move ahead. Okay, so now once we get to here, and we are going to drive off this foot and knee, pushing into the center. You do that well too, so that's a positive. You see the body lean though? You're so heavily leaned into the center. That's where that patience out around the left right at the beginning will help. I'd like to see you just a little bit more here with that chest back just a hair, okay? A little more upright. Now, going from here. Love this entry into the center. I love the drive. What I feel like, though, when I see this, okay, see this, is that you are over-rotating just a little much. We're obviously rotating. This is a rotational shot, but it's much more linear than people think. And I'd like to see you get out around that left and come more to center here in the actual center of the board. Okay? You're going a little bit past center, and what that does is it has a tendency to make you fall off. Oh, that's not the one I wanted, sorry. Has a tendency to make you fall off to the throw off to the left, and you don't get full drive right through. Okay. Once again, these are small little things, Darnez, and I'm really excited about this particular throw because you're not that far off from getting some, increases to your PBs and PRs. So, getting through to the center. So what I like to see and what I look for in all throwers, both young and old, is this. And once again, I talk about it in the Krauser breakdown, is I want to see where your eyes and your right hip are pointed. So I want to see, as you're coming through the center of the circle, that your eyes are still looking towards the field and that this right hip is driving towards the field before it turns, all right? And what I see here is that your head's already turned and your hip is already starting to turn a little too soon. Be patient and throw your hip at the field, then turn. Throw your eyes at the field, catch the front focal, and then you can turn to the back, okay? Okay. So really good driving in the center. I'd like to see you up on that toe more. Okay, you see how you're kind of flat-footed? And it actually gets a little worse right here. So now you're completely flat-footed. And we want to be as up on that toe as you can. I'm not sure if that's the injured leg or not, but let's try to be up on the toe as opposed to flat-footed, because that allows you to actually drive and turn off it and push off that. Okay? Let's watch the finish. Okay, so here, we want to get, there we go, this foot down, your block foot down a little bit sooner, because what's happened is because it's a little bit lazy, it's allowed your weight to shift to the front, and now you're already off that back foot. So you see how all your weight now is on the front foot, and the shot has not even left your hand. Okay, we just want to stay back on that a little bit more, and you can do that by getting up on the toe and hammering that block foot down into the board a little bit sooner. I don't want to give you much more to think about because that's a lot of things, and I always want my throwers to focus on one or two things. So let's just look at this. Let's work on being a little bit more patient out around the left here. Okay, that's number one. And number two, getting up on that toe. Alrighty? Okay, so hopefully that made sense. If you have any practices coming up, there are drills you can do for that. I can send you drills unless you just do your own drills. 360s are great drills for the out around the left. Just keep doing 360s, because that teaches you to be patient on the rotation on that left knee, okay? Other than that, just those two things, and then we can talk after I see some more film.